Welcome back. Thank you very much. And for the new subscribers, or sorry, for the people that are just meeting my channel for the first time, I hope you have subscribed. That short break we had, I hope you click that subscribe button. Please do. It is free. You can also share my link. People tell me, Nosifela, I love what you're doing, but you're not helping me. The only way you can help me is by sharing my links. Once I upload videos, I know I don't do this consistently, but pardon me, I'll try, motherhood and a lot of it. Share my links. Share it on your story, encourage your statuses, encourage your friends to watch my video. That's how you can help me blow. Help my ministry of free and public health education. That's simple. Now, before I delve into the main story, let us remember that pain is not an objective data. Objective is something you can see and feel. Pain is a subjective data. Pain is whatever the person says it is. Pain is not your opinion. Pain is a person's opinion. And that's how life is. Some people have it easier. Some people have it harder. If you have it easy, if you have it hard, it doesn't mean you're not doing well. It only means that that's your roots. And you have to just try and excel in everything we do. Now, for me, it wasn't a very, very palatable procedure. It wasn't a very, very good experience for me. I've had to ask people who had done similar surgery, and they were like, oh, after second day, I was able to chew. Oh, after 2 days, I was up and running. But for me, for over 2 weeks, I was not able to chew with the surgical sides. Trust me, I was just chewing with this, and I was taking very soft food, actually. Now, I want this to be very interesting. So if you have had this kind of surgery before, tooth extraction, please kindly drop a comment for me in the comment section. I'd like to know, how was your experience? How was it like for you? Now, for me, and we're going to have intermittent short breaks because I'm going to be showing us pictures. I couldn't really make a video. I was in great pain. I couldn't really make a video about the procedure, but as a medical personnel, I can always explain to us. I took some pictures, so we're gonna have intermittent breaks where I'm gonna be showing us, because I don't want this to be boring. I want to be showing us some pictures and how it was going, how it was doing, and all of that. But at the point I got tired of doing the everyday. I think I did it just twice, and I'm like, God, this pain has not left me. Yeah, so it started with like a sore in my mouth. Actually, that's why preventive healthcare is very important. But I'm still glad that I did the surgery in Canada here, because more than 3 or 4 years ago, I was told that I have an impacted wisdom tooth. Impacted means that it didn't come out at all. The normal teeth, you will see them how it's like this. That one was embedded in the gum, like kojari rara. It didn't come out at all. So whenever I chew with the ones that are out, I'm pressing on it, and that way it is causing harm to the others. I was told in Babcock University, in fact, I was booked for surgery, and trust me, I ran away. On the day of surgery, I was called. I said I was not feeling fine. But later on this year again, it came to me. That's, if I had done it that time, I wouldn't have suffered this way. I would have forgotten about the sufferness. Maybe you wouldn't even have gotten to this stage. But hey, I'm still glad that God saw me through. Yes, so it started with like sort of pain. For like 3 days, I was trying to manage it. I didn't want to really just take medications anyhow, because ever since I got there, I've not been taking medications anyhow. I don't know. I think the environment kind of influences your health too. So I was trying to manage it, but on like the 3rd or 4th day, it was not getting any better. I'm like, okay, let's go and see the doctor. So we went to see the doctor, went to the dentist, and when we got there, he did an x-ray for me first after my complaint, and that was the first thing he told me. You have an impacted wisdom tooth. In fact, I have 4 impacted wisdom tooth. There is one here. In fact, that one is so funny because he appeared like I don't know, it appears so funny. He's in the bone, right? Then it's like this. It's not like this. The others are like this. That one is like this. I'm like, what kind of devilish teeth is this? So anyways, so he told me that, okay, the solution is about to remove the tooth. So I'm like, I was just in pain. I've read about tooth extraction, but I have not experienced. That's why all this theory, practical is the main thing. If I had experienced it before, I'd asked somebody have told me about it before, maybe I would have been prepared. But trust me, I was not prepared at all for what I saw and what I experienced. So like, okay, no problem, I'll do it, because I thought, okay, I'll just take my Negesia and blah blah blah, and we'll do it. And so I took we started. He told me that I was going to freeze the mouth. So we used the freezing agent, freezed my mouth. So it was heavy, very heavy. Freezed the upper palate as well. The upper palate is that's the upper palate. Freeze the upper palate. That was painful. Putting the needle when it's going in, it's really painful because I have a very pain threshold, but I had to just endure it. After freezing, I thought, okay, that will be hot because there was no pain. I was feeling pressure. But the problem with dental surgery that I don't like, I don't know for Nigeria, is that I thought there would be something to help me gag my mouth, like, open my mouth till after the surgery. There was nothing like that. I had to be the one doing the mouth opening. Like, open my mouth for over 2 hours. Because the bone around the teeth is so dense, like we couldn't get it out on time. So opening the mouth was my major issue. My mouth was heavy, it was painful, even despite the analgesia I took. It was painful because, it's not easy for you to just open your mouth, and about 4 instruments into my mouth at a time. I wish I could film the instrument, but I was in severe pain. Pain is a very, very bad thing. So I was like enjoying it before we got in fact, at the point I was crying. I was really, really in pain. I was so crying, and I told him that get my husband for me. Just tell him I'm no longer interested in this procedure. I don't want to do it. Plus, the procedure is even very expensive, close to $1,000 for tooth extraction too, plus X-ray and blah blah blah. I'm like, this is expensive because I didn't go to the. Usually healthcare is free in Canada, but I didn't go to the emergency. If I gone to the emergency, I'm not sure they have the dental side of it free or something, but we went to a private dental clinic. Close to $1,000. I told my husband, are you sure we'll be able to afford this or something? My husband was like, well, I'm not saying we can't afford this, but it's your health. Are we going to say because it's $1,000 we're going to be pulling out of the family finance or resource? We won't do it. But you're paying, you have to do it. I'm like, okay, let's do it. My sister, my brother, oh God, like it was hell of a war for me. If somebody tells me to pick between giving birth to 12 children, like dozen, and having to go through dental surgery, I'm going to pick giving birth to 12 children. Because in labor, once you have taken that epidural, my sister, you are on top of the world. You feel like awesome. That relaxation, it just comes. I love epidural. Oh my God. I'm still going to talk about my labor experience. Epidural. God bless whoever invented epidural. You are blessed. God, you will just feel like all your problems gone. You will be so relaxed. But with dental surgery, you are going to be participating in the surgery. You are not going to have peace. With epidural, I have peace. When the urge to push came, I pushed. That was it. My baby came out. Although my epidural was wearing out by the time baby was coming, so I feel a little pain, but it was okay. But this one, the fact that I don't have to open my mouth, that was my problem. So dental surgery is very participatory. So it was a lot of work to really get the tooth out. In fact, I don't know, I was crying. I was just blaming myself. Like, why did you agree to do this surgery? Why did you tell the doctor to give you something palliative, like a drug to make you stay for 3-7 days and be good? I was saying all sort of things myself, crying. I was in deep mess. The next picture you're gonna see me on that day of the surgery and everything. Now let's go for a short break where you see me on the day of surgery and everything. Then we'll talk about the aftermath of the surgery and all of it. I'm still here. So welcome back. Thank you very much. If you're yet to subscribe to my channel, kindly take time to subscribe, please. What is what is it in French? What is please in French? I can't remember. I'm doing French class, but I can't remember. So anyways, so that was me on the day of the surgery. You can see that it was a lot of work and stress for me. Oh my God. Yes. So after the surgery, it gave me a list of what not to do. Do not gargle. I already gave an explanation of of why I won't do that or why I'm not supposed to do that. It's in the video that I'm going to be showing you.
So this was me in the examination
yes,
room.
after this time,
I was in routine here.
Do not
I think we not
gargle,
started
do not
here,
eat,
and
do not chew.
just
And then on
I'm
the
just
first
observing.
day,
And
when I got
this is
home,
me after.
first
You
day
can see that the
when I
face
got
has
home,
changed. It was really a lot of work.
they told me to
Trust
take ice
me,
cream. I
it
took
was not
ice
palatable.
cream,
So
something cold,
I went to the
just to
toilet,
relax
and
the
that
muscles
was
of
the
the mouth.
first
And I was supposed to actually
after the
do
surgery,
like
I had to go pee, and sorry that's
a
blood,
cold
but hey,
compress, but I forgot.
it is what it
Because
is.
it wasn't
It's
like I
not.
forgot.
It
I
is
was
not
so cold
palatable.
after the surgery.
It
I
is
don't know
not.
what caused that.
It
Maybe
is
it was
not.
analgesia. I
Yeah.
don't even know. I was so cold
So
after the
getting ready
surgery.
to
So I
go
told my husband,
home,
let's just chill. But
I was
slept
thinking,
off
okay, maybe in
because I
2-3
took
days I'll be up and running, but it's a
sedative. I
lie.
slept off
This
and
pain.
next morning.
In fact,
So my mouth is
let's
I have
just
a picture. So
continue.
after
I
this
don't want
time,
to
I'm
say
going to be showing
everything
you.
now
When we go on
because
break now, I'll show
we're
you the
going on a
picture,
roller coaster. You don't
and I'll show
understand.
you
You
my
know me
progress when I
now.
woke up.
Let's go there.
It wasn't not easy, you know. In fact, I was basically cooking for my family, but I didn't have a taste of what it is. I have a video of when I had to the first time I was able, you know, as in every part of the body is interesting and important. I didn't know my teeth can be this important until I did the surgery. Like I chew like this. It's not easy. And like I don't get to feel the taste of the food because when I'm chewing, I try not to. This is the surgical side. I try not to make the food come here. So if I don't want it to come here, it does not have to touch my tongue. It shouldn't. If it touches my tongue, then it is coming here. So automatically, I have not even tasted what I'm eating. I'm just eating. In fact, I was just cooking for my family. I just taste it a little and spit it out again. So God, in fact, good health is underrated. See, a lot of times I know we need money, we need things, we need this, we need that. But hey, if you have good health, like if you are in good health and everything is working, like you don't have to have everything. You don't have to have the whole world. I do not have the whole world, but good health. And it was at that point in time that I also knew that touch. Word of affirmation, you know, telling somebody that they are doing great, it is well, it's going to be fine. It really goes a long way. That's why when people are sick sometimes, if we have money, it's good to give them money and to buy them provision, Bonvita and all these things. But if we don't have, trust me, that your act of service is very important. The nurse kept holding my hand. Nurses, kudos to every nurse out there. You are doing great. I love you. You're wonderful. You are a supreme being. I don't know, God is a supreme being we have, but I don't want to compare you to God, but I don't know, as in the fact that nurses are there for you at every stage of life makes me just, I don't have the right word to qualify nurses. Like, you know, the nurse kept holding my hand, you're doing well, Helen, you are this, you are that, as in for every time. Sometimes I'm really in pain, and once she just holds my hand, I feel this comfort, I feel this love. So I don't know, nurses out there, kudos to you. So it wasn't really a palatable experience for me. And now we're going to be going on another break to see you aftermath of the surgery, how I was coping and blah blah blah. I had to use clove at a certain time, and it was good. It was good. I'm still going to be sharing more. Let's go on this quick short break. Hi, so this is update. Second day post-op was still swollen. I'm still swollen rather, just me. But not as much as yesterday. I couldn't do a video yesterday, but I have a picture. So yesterday I went for a checkup. This abrasion is as a result of too many instruments entering into my mouth at the same time. I'm from open, keep opening your mouth. I just put this a lot on black. So if you're thinking of a dental surgery, you have to be patient and expect that it's not very palatable. I'm going to shed more light on that. Anyway, so second day post-op progress. And yesterday I was at my doctor for checkup. That's first day post-op. I went for checkup, and then we focused more on trying to relaxing the muscle, because during the surgery my cheek was frozen. And for the relaxation techniques that he taught me, although he gave me some drugs to help me relax. Normally, as an adult, just 3 hands supposed to, your mouth supposed to be able to accommodate 3 hands this way. 3 hands supposed to enter the mouth. So for me now, it's still a lot of work. So that means the muscles are not fully relaxed because of the anesthesia. So right, for the relaxation technique, all I need to do is to pull my mouth till I feel pain. I keep doing that multiple times a day so that it can help me to relax the muscles there. Oh.
This is Thursday post-op. Yeah, my mouth.
I'm supposed to pull longer than that, but just showing you guys how it is done. I feel the pain, I stop. So I do it multiple times in a day, and I still rinse with salt and water. I started doing that second day post-op. No, first day post-op. That was yesterday. And I don't gargle. You don't gargle because you don't want the blood clot. Normally, there's supposed to be a blood clot formed in the place where the teeth was taken out. So I don't want the blood clot to dislodge. So I just like put the water into my mouth with the salt and kind of hold it there. I don't gargle. I like shake so it doesn't dislodge the blood clot. So basically that's why I chew with my left tooth now. I can't chew with the right one yet. Take a lot of liquid, and it's been good. So I'll keep you updated. Thursday post-op will be tomorrow, and I'll be sharing how I brush my teeth in the morning and things I do before I now do the breakdown of the main procedure when I'm much better. This one is just a progress note, like a progress report. So this is me at almost 3 a.m. I woke up with pain. Pardon my spila seleka. Still swollen, right? But I think it's reducing. I don't know. So I'm taking clove. I've taken my drug. Then I'm also using this clove. I find it helpful because it kind of produces one sensation of cooling, like a cooling effect. That's English. So basically, I just my sister got me this. My beautiful sister, an amazing sister, got me this. Thank you so much. I like it. She said it's very helpful. I can say it's helpful. So one day at a time, I'm pulling through. Hi guys, thank you so much. I told you already that this is a roller coaster. Anyways, thank you so much for joining me. We're almost rounding up. Now, I did not start showing with this teeth, that's the surgical side, until May 13th. I'm proud to May 13th. You know, I went to the doctor's place on the second day post-op. Yes, second day post-op. Do you know that I had to return again for 5 or 6 day post-op because the pain was now unimaginable. Like, I was weeping. My husband had to drive me back. Like, my wife is not well because of this teeth, and the doctor he mentioned the name. I can't remember, but it's the thing. You remember the clove I showed you the other time? It was like clove but melted. He just put it into my tooth and then gave me analgesic, and trust me guys, for a whole 3-4 days I didn't feel pain. And I didn't use analgesic. Like, that thing was like epidural. I was a problem solver. It just took away my pain. I was so on top of it. In fact, I knew that I didn't have power to stop my husband. I was just doing smeg up, and that day my husband knew that I had power. I started disturbing him. I started disturbing the house, jumping on him, throwing pillow, doing, oh my god, there was nothing I didn't do. Yeah, but after like 2-3 days or maybe 4 days about, I started having pain. I'm like, oh my god, this thing is back. What sort of nonsense is this? So I started taking analgesic because he gave me
the pain
that
the soreness is reducing in this place. You can see that it's not as swollen as before.
Started like, okay, that I was just watching it. You know, it's so hard to chew, so I couldn't chew with this teeth. Then I noticed that I started feeling some kind of pain on the teeth itself, and in the tooth, like the roll, this roll, not the surgical side, like the roll of the tooth, like on top of my teeth. I was feeling that pain like on top. So I told myself, I'm a medical personnel. I've done a surgery. I know that with good blood flow, eating right, nutrients, and a lot of that, the supply, wound healing should take place at least for a surgery that is not so much. In 7 days, it should have approximated at least. Even if it has not fully healed inside, it will have approximated. So I'm like, and somebody saying I should not eat for over 3 weeks. But doctor told me not to eat for over 3 weeks. But the day he called me to tell me, I said, you can't tell me that rubbish. I will not eat for over 3 days, over 3 weeks. I could possibly that I like food. People are saying don't eat for over 3 weeks. Hey. So I told myself, okay, as a medical personnel, he sutured it. In fact, I didn't even know they actually used to suture the surgical site of a tooth extraction. He sutured it. I'm like, Okay, and the suture was an absorbable suture. Absorbable. It means that there are sutures that can absorb into your skin without problem. It's without problem. There are sutures that you have to cut away, like remove. When you say you go for suture remover, if it's like a suture of the outer skin, but inner layers of the skin, you use absorbable suture. Those ones can easily absorb into the skin. So the suture absorbs into it. So I'm like, I can start chewing, because there's another principle of medicine that I applied. If you have a limb pain, and because of that limb pain, you are not making use of that leg because you are feeling pain on that leg. Trust me, that leg will become stiff over time. Like if you leave it for so long, it will become stiff, then the pain will increase, because the day you now try to use that leg, you're going to be in a lot of pain. That is why people that are in wheelchair, when they start their occupational therapy process and rehabilitation process, they feel a lot of pain on the first 2-3 days. It is because they have not been using that muscle. So I'm like, if I don't use this teeth, then this pain will continue. So I told myself, if you're going to endure this, you'll start chewing. It's already over 2 weeks, so you can start chewing. So I started with fruit. My husband was like, you started eating with your teeth. I'm like, I just want to try it. I started with fruit. It wasn't easy. I graduated to swallows, like that, and I picked my rice on the 13th. That's the fried rice, and I ate it. I'm like, this is really good. So till now, even now, it's still like the teeth still feels strange to me myself compared to this one that has not affected. But at least it's better. I can open my mouth wide. Three arms can go into my mouth now. Freely. I can do that. So I bless God, and so if you're thinking of tooth extraction, I'll just say it is better for you to take care of proper care of your teeth. If you have not been brushing twice daily, now I brush twice daily. Nobody they teach me. I brush twice daily. I finish this video now because this is past 11. This is when I can do this video. My son is sleeping. I'll go and brush my teeth. So brush twice daily. Visit your dentist. It is very important. Do checkup. Do proper checkup every time. At least do maybe once in 3 months or once in 6 months. If there is any free health screening for the dental part of the body, that's the teeth, go and do it. Preventing medicine is important. That's the cocoa, the story of this video that I'm doing, is that you have to take care of your teeth. Don't say it's just my teeth. Dental problem, dental surgery, they easy. It is not an easy task at all. Come and ask me. Some people may have it. Some people said I remove 5. But me, if you know your pain threshold is low, I don't want to undergo dental surgery like me. Take care of your teeth. Avoid smoking. Avoid chewing, eating chocolate and all those things. If you eat them, if you have to sparingly, because I can't say don't eat chocolate at all. If you like it, then make sure to brush your teeth. Use all those toothpaste that are very sensitive, that are very good for sensitive teeth. So I think that's the end of Nasufa Health and Lifestyle YouTube channel for today. I'm going to be seeing some other time when I'm going to be sharing something very interesting. I'm going to try to be back again in a week, like do another video for a week. Please subscribe. Please, I beg you, subscribe to my channel. Share my links to your friend. I love you all. Thank you so much for your support. Thanks for the love. Thanks for the like, the comment, everything. I see them, I reply, and I'm grateful. I see you. Bye.
That's right. So yummy. My God, I made this rice since I've not been able to eat it. I've been eating with only one side of my mouth because I did tooth extraction. I couldn't eat this thing. I don't know the taste of this food because every time I eat with this one, I just tell you, I don't want it to touch my tongue. My dear, every part of the body is important. And now I know the difference of my teeth. The food is though. This rice. Osanobra. Okay. Now what? Now what's up with the mix with all these dishes? And you don't finish it. My young people, they don't finish it. See what I made. But it's okay. Mine just.
So it's appointment day. It's my dental appointment day. I'm a lot better than it was the first time I was in this room. I was in great pain, as you can see in the video that we had before now. But today, everybody said I'm a new person. Like, didn't even know I was such a joker. Like, I play a lot, but when you're in pain, do you play? Pain is really serious. Please be nice to whoever you know that has pain. Pain is really serious. And the dental facility is really good. Horizon Dental Facility in Canada. I love it. Sure. Here I'm going for cleaning soon. Gotcha. Awesome.
Actually, to see James Bond, this was my appointment day. I'm here better now to show them that I'm a fine girl. That day was just like that. So I went to my freshness. I not seen this skin. I have to see this skin like this. Skin like glass. You understand? Almost to shatter.
It's really so nice and highly explanatory. So this goes. So this is what we use for the.
Yeah, I put it in here to be clear. They call Cavitron in there.
And I love this suction.
Yeah, wait. Yeah, let me put it here.
Yeah, and this is for water to rinse.
Water,
Yeah.
it's water and air.
Yeah.
You see, as I show you, this is air
Okay.
and water.
Yeah. Oh, it's both
To
air
clean,
and water.
yeah.
Oh.
And sometimes if
What
I
does
need,
the air do? When you put the hair, what does it do?
the air, sometimes I need the pressure to clean from the profit. You
Okay.
see, I push both button. It's like little pressure to take it out. This is the air alone and the water
The
alone.
water.